This is Paula Merger with Pixels and Pills here at the ePatient conference in Philadelphia in 2010, and I am delighted to have Ben Sawyer here for an interview because I was quite surprised when I came to the conference and saw that Ben was here representing the Games for Health track. Now, Ben, I've been going to your conferences since, I think, the one in Baltimore, like 2004, 2005. And I thoroughly enjoy them every year. It's always a whole new track of people coming on board. So to see you here in a more pharma context was very interesting to me. And maybe you can explain how you and Kevin actually formalize the relationship so that you have your own track and people in the pharmaceutical industry are now being exposed more to the Games for Health ideas.
Well, I think Kevin's always looking for things that are innovative. We certainly at least represent a community of innovators who are trying to use video games and video game technologies for health and healthcare with the Games for Health project. And so he came to our conference the last couple of years, and I know last year he had a couple of sessions on it. And then this year he wanted to work with these breakout tracks and really have them hosted and curated by people who kind of had a sense of what was going on in that space at a lot deeper level than Kevin's doing, because he's got to kind of pull all of the pieces together. So he asked us if we would be interested in reaching an audience that we sometimes reach at our event or sometimes reach at others, but this is a wonderful audience to be in front of. And so we took the opportunity up. We brought in some of our really good speakers, and they've put on a good show so far.
That's fabulous. So when you were curating, because I know when we go to your events, I mean, you have multiple tracks over multiple days. So when you did that editorial process to figure out which speakers or which projects would strike a chord with this audience, knowing that ePatients is about really empowering and enabling the patient population.
Well, we looked at the areas in Games for Health that are sort of mature, and that's a relative term, right? And we thought that we needed to do some talks along those areas because at this conference, from an empowerment standpoint, I think at least you have a lot of attendees who want to see things get into the field effectively now. Yes, they're incubating new things that we might see next year or 2 years or 5 years or 10 years from now. But there is a real interest in seeing things that are actionable. People don't want to wait. I think that's a theme, whether you're a patient or someone who's trying to help them. People don't want to wait. And so we brought things that we thought were a little bit more further along. So people dealing with sensory motor rehab, where we're seeing a lot of great effective use and research, where it will eventually manifest itself, I think, into sustained and efficacious products, as well as exergaming, which already is $1 billion market, although the sales are ahead of its effectiveness. We all have, we used to put a treadmill in the corner and leave it alone. Now we're kind of doing that a little bit with exergames. So we're trying to figure out why we don't want exergames to follow that path. So how do we do that? So we've had talks on that. And then we brought in things on cognitive and emotional health, another sort of fast-moving field that's starting to debut products and starting to see more and more research. So that's what were the determinants. Whereas at the Games for Health conference, we try to look at everything and in fact look even more on the incubation level. So things like global health with games, which we wouldn't necessarily do here yet. Because I think this conference, when I think about ePatient Dave and when I think about the talks this morning from Cisco and Pfizer and others, they're really looking at what tools can they effectively use now. So we tried to focus on that.
And then for your conferences, we'll leave the discussions of getting ICD-9 codes for game and what have you, correct?
Well, I mean,
the business model and the insurance companies and that whole consciousness raising level.
I think eventually we'll see these types of, whether it's Games for Health or other types of emergent practices, new ideas in health and healthcare, they will eventually be adopted. And in fact, what we made the point in our conversation yesterday was consumers are adopting these things ahead of providers, ahead of doctors. Now, sometimes there's risk associated with that. But when I brought this up with the Robert Wood Johnson Foundation, who funds our project, what they reminded me of is that's the history of healthcare, good and bad, right? So that's a warning and a positive sign. And, I don't think games are any different in that regard. So what our job is as a project is to help bring about the things that are effective, that do have evidence-based practice. But don't think about it as like we're not gatekeepers any more than anybody else in this space. The consumers are going to drive it, but it's our job to make sure they don't drive it off a cliff, right? And
park it in the
Yeah, and it might not be consumers either, let's be fair, right? I mean, providers have not necessarily always been right either. I mean, this is the frustration and the challenge and the promise is to cut through these things with these new tools like eHealth, like ePatient type systems and like Games for Health. So that's what we're here for.
So maybe as a challenge, we can let you go back to your Robert Wood Johnson contacts and talked about how open notes in the EMR space maybe could start hooking up with some of the games that the consumers are already using.
Well, we're already doing that. I mean, the Pioneer portfolio at Robert Wood Johnson has also been funding a lot of work on personal health records with Patty Brennan's work in Wisconsin. And that National Program Office is really looking at how we reinvent PHRs and EMRs. What we've been doing on our corner is looking at how games collect information, how they create new interfaces to that, and how they actually have, in certain cases like WeFit, embedded personal health records that actually are complied with to some extent and done with no resources from the health establishment at all, which is really fascinating. So last year at our conference, and we showed some of that work yesterday, we had some game developers bring some of their concept artists from Imagine Engine, which is a Boston-based game developer, and they helped our attendees visualize new ideas for personal health records that were influenced by ideas that they've had in the game space. So I think actually with things like open notes and how we create those things and plug those into the interfaces and the actionable things that games do, we're thinking about that. And we're trying to bring that forward in a way where other people can buy into that thought process and actually implement it. Because to implement these things is not going to just be unilateral.
Ben, I thank you so much. I think we've taken the conversation into some different directions, but it's all food for thought.
Okay, thank you, and thanks for having me.
Very good. This is Paula signing off, ePatient Conference for Pixels and Pills.